Back to
Thank,
Victoria.
thank you so much. Without further ado, I'm going to pass it along to Miss Suzanne Boylan, who is the Senior Manager of Coordinated Entry here with the Homeless Leadership Alliance. Suzanne?
Thank you so much, Victoria. Welcome, everyone. Good evening. I'm so glad for all of you that are on today and those of you that were not able to join on today. Like Victoria said, this will be recorded. So questions, feel free to ask any questions at the end of our info session. And I believe there might be a Q&A box as well for everyone to plug in your questions so you don't forget. My name is Suzanne Boylan. I'm the Senior Manager of Coordinate Entry. And today I'll be giving you a quick overview of Coordinate Entry, what it is, how it works within our community and our continuum of care, and why it's so important for our community and all communities in general. Again, if you have any questions, don't worry. Also, my contact information will be on the last slide at the end, so you can always reach out to me at any time. All right, let's get started. Thank you. So as I talk about coordinate entry, some of you may not even know what that is. Some of you may know what that is already. Or some of you may have heard that word, right? And really need a little bit more context to what it is that entails, what a coordinate entry system is. So coordinated entry is a system designed to make sure that people experiencing homelessness can get connected to the right housing and support as quickly as possible. So it's a system that helps people find housing and services faster. Instead of people having to call around to different programs on their own, this kind of system makes the process organized and specifically fair. So it's important, coordinated entry is important because homelessness in itself is a very complex issue, and no single program can solve it alone, right? And so that's why coordinated entry exists. Coordinated entry and its system brings together all of those housing services and resources in the community to match people with the best options for their needs. So coordinated entry works in a few different ways. So coordinated entry prioritizes the most vulnerable, right? So people who need the most help get housing and services first, those that are the most vulnerable. Coordinated entry also makes access fair and equal. So everyone experiencing homelessness has the same chance to get help in a fair way. Coordinated entry also prevents people from slipping through those cracks. So instead of getting lost in the system, people are connected directly to support. And coordinated entry uses a housing first approach. So housing first means that people can get housing first without having to meet any extra conditions before getting help. So by working together and making sure resources are used effectively, coordinated entry is that system that helps move those closer to ending homelessness in our community. Next slide. Thank you. So I also want to talk about what makes a strong and fair coordinated entry system. So a system that helps people experiencing homelessness get connected to housing and support as quickly as possible. And that's what makes a strong and fair coordinated entry system. A coordinated entry system has to have a housing first approach, which I had mentioned before. But just to reiterate, it means that we're focusing on getting people into housing first and then providing support to help them stay stable and sustainable with those intensive supports. It also must have fair and consistent decision making. So the same tools and processes must be used for everyone across the system so there's no confusion and everyone is aligned. Also, transparency, right? The process should be very clear. It should be very easy to understand for everyone involved, including service providers and the actual people that we're serving, right? Prioritization over first come, first serve. So we help the people who need it the most vulnerable first, right? Rather than just helping whoever asks first. This makes the system fair and ensures that the most vulnerable get help quickly and promptly. A smooth process from start to finish. Coordinated entry guides people from the moment that they ask for help until they move into a safe and stable home. And coordinated entry does entail four core elements. And so a strong coordinated entry system is built on those four main elements, which we'll go over next in the next upcoming slides. Following these key points that I just went through and these coordinated entry musts, we make sure that housing and services go to those who need them the most quickly, fairly, and efficiently. So finding housing can be overwhelming for anyone, right? Especially people experiencing homelessness. It often feels like a maze with no clear direction, and that's where coordinated entry for individuals and families and those subpopulations in between, such as veterans, etc., come in. So coordinated entry makes the process easier and fair by providing a standardized way to access housing and services. It ensures that everyone gets the right support for both their immediate and long-term needs through a client-centered approach. Before coordinated entry, different service providers use different forms, they use different assessment, and they also use different processes. So that led to inconsistent decisions and a lot of confusion about what housing and services were available within our community. Now, every program that participates in coordinated entry follows standard forms and a shared approach to making decisions. So instead of a scattered system and a complex system, we've streamlined that, right? We have now a coordinated referral process, and that connects people to the right housing and the right support based on their needs. Here in Pinellas County, providers are working together strategically, right, endlessly to better serve individuals and families experiencing homelessness. And we're all using data-driven and evidence-based methods to improve those outcomes and to ensure resources are used effectively amongst all. A strong coordinated entry system is key to reaching the goals of the HEARTH Act, opening doors, which is that federal plan to end homelessness. So that HEARTH Act helps us move away from scattered programs toward a unified approach, and one that quickly matches people to the best available housing and support to help them get back on their feet. So by working together, we can continue building a system that is fair, efficient, and effective in helping people find housing and stability. Next slide. Thank you. So I just want to walk you through those elements of coordinated entry. So those four key parts of CE or coordinated entry. These are the steps that help ensure people experiencing homelessness get connected to the right support. So the four core elements are access, assessment, prioritization, and referral. So access is that first step, right? That front door. It's where everything starts. And it's the first point of contact for people facing a housing crisis. It can be through a street outreach team, a shelter, or another community service provider. And the goal is to make sure that everyone has a clear way to get help. And that second element is the assessment piece. So it's understanding what that need is for the person, right? For you, that may have accessed our system to begin with. So once someone reaches out for help, that's that next step. So what assessment means is we're gathering all that important information about your housing situation, your needs, and any barriers that you or the person reaching out might be facing. So the goal is to understand what kind of help you or that person needs and what type of housing support would work best for them. The third element is prioritization. And that's helping those who need it most, the most vulnerable. Because there are limited housing resources, we use prioritization to make sure those who need the most help, the most vulnerable, get assistance first. And this process helps us match the right people with the right housing services based on their level of need and their level of vulnerability. The last element is referral, so connecting those to housing and services. This is when individuals or families, veterans, right, are matched with available housing resources or services based on the community's guidelines. So the goal is to help them find a stable housing solution as quickly as possible. So by following these four steps, which are again, access, assessment, prioritization, and referral, coordinated entry creates that fair and effective system that ensures people experiencing homelessness get the right support at the right time. Next slide. All right, so now let's talk about how people can access the coordinated entry system here in Pinellas County. It's really important to know where people, right, your friends, your neighbors, anyone can face homelessness at any given time. So it's important to know when they need help, where they can go, right? So coordinated entry, for one, just to reiterate, it's open to all household types, including youth-only households, single adults, adult-only households like friends or non-married couples, LGBTQIA plus households, families with minor children. No matter their situation, people in need can connect with a coordinated entry access point to get started in this process. And there are several designated access points for people experiencing homelessness in Pinellas County, including emergency shelters, street outreach teams, First Contact, formerly known as 211, HLA's Rapid Resolution Community Navigation Team. We also have HLA Veteran Navigation. And so those specialized access points, some that I named just a moment ago, I wanted to kind of go over a little bit because we do have special access points for domestic violence survivors, such as CASA and the Haven, or Hope Villages. And those special access points for domestic violence survivors ensures that survivors of domestic violence receive safe and appropriate services. So DV shelter providers handle the initial coordinated entry assessment and then refer individuals as needed. Veterans who may be experiencing homelessness. So veterans can access special support through HLA's Veteran Navigation Team, where they are screened for veteran-specific programs, such as GPD or grant per diem programs, VA benefits such as HUD-VASH, and even supportive services for veteran families, for short SSVF. Next slide. So how we assess and prioritize people in the coordinated entry system. That's something that I want to touch on also. So the goal is to ensure that everyone gets fair and equal access to the services that they need. So assessments are important, right? But even more so important is that we use those shared assessment tools to keep the coordinated entry process consistent across our community. So this means that no matter where someone seeks help, they're assessed the same way and they're connected to the right resources. Our assessments focus on a person-centered approach, meaning we look at an individual's unique situation while we're making sure that the process is fair and trauma-informed and efficient. We do have different types of assessments here within our community in our county. We have our family shelter assessment, which is a tool that helps prioritize literally homeless families with minor children in need of emergency shelter. Once completed, once that assessment's completed, that family is added to the shelter prioritization list, and they're assigned to a specialist at the HLA. This allows families to access the coordinated entry system quickly, even if they haven't stayed in a shelter yet. And then we have the coordinated entry assessment. Currently, the tool that we are using specifically at this current time is the VI SPDAT. Um, this is a vulnerability index that helps prioritize literally homeless individuals and families for housing and supportive services. Lastly, we have a full SPDAT, right? It's a more in-depth SPDAT, excuse me, it's a more in-depth assessment that's used for service planning. So it's very, very in-depth, very intensive, and it helps identify areas where support is needed to avoid housing instability and to track that progress towards housing stability. All assessments, right, including the primary CE assessment, must include trauma-informed and culturally competent questions for special populations such as immigrants and refugees, youth, people fleeing domestic violence, LGBTQIA plus individuals. And what cultural competence means, it's your understanding and responding to each person's unique background and needs. So those that complete coordinated entry assessments in our community are street outreach teams. They can be emergency shelter case managers, HLA teams, staff at SSVF, and also transitional housing on a case-by-case situation.
Suzanne?
Yes.
So sorry. We are actually right at about time for
Okay.
this part of the presentation, but I know that you have a couple of really important things that you wanted to make sure that this group knows about. So if you don't mind me asking, and of course there will be an opportunity, everybody, to ask Suzanne some more questions and to see the rest of this presentation
Okay.
afterwards. But Suzanne, when we're talking about these assessments, who has access to the information that we are putting into these assessments?
Great question. So the who has access, right? So we do ensure fair access for everyone, but we also ensure that all of the protected personal information is secure. So we take that privacy and security very seriously when we're collecting and handling client information. So only those that have information that have access to our HMIS system, which is a system that is used collectively amongst all continuum of cares, can have access to that information. We do not give access or information to law enforcement. There are strict guidelines and protocols and policies in place that protect those and their information that are being added into our HMIS system. But there are a lot more details that can be provided on my slide in my PowerPoint that I'm sure will be sent out to everyone.
That is so good to know, Suzanne. So, really, the point of the assessments is to make sure that people are, and step in if I'm wrong, but the point of the assessments is really to make sure that people are being connected to the right services, and that the folks with the greatest need are being connected to those services first. And the only people that are accessing that information are like people specifically licensed to. So it's not, just publicly available to everybody or something like that. Is that about right?
That is completely accurate.
Awesome. Awesome. That is such good information. Thank you so much, Suzanne. And please, if you have questions about coordinated entry or why we do these assessments, who has access to these assessments, what might be on these assessments, go ahead and pop that in the chat because Suzanne will be staying on with us to answer more questions afterwards.